Hello, my name is Caitlin Emmerich, and I'm with Linn County Public Health, and I'm going to be moderating our virtual town hall today. The virtual town halls are something that we started last week to provide additional information to our community about popular or relevant topics related to the COVID-19 pandemic. Last week, we focused on community spread and communicable disease control. And this week, our topic is mental health during the COVID-19 pandemic. We do have 4 panelists that are available to answer questions today. I will briefly ask our panelists to introduce themselves, and then we will move into the questions. Adrienne from Foundation 2, would you like to introduce yourself briefly?
Yeah, absolutely. Hi, I'm Adrienne Corbacus. I work for Foundation 2 in Crisis Services, and I oversee our mobile crisis outreach program.
Christy, would you like to go next?
Yes, I'm Christy Aquino. I am the Employee Assistance Program Coordinator at St. Luke's Hospital, and I'm also a clinical therapist.
Kathy, can you please go next?
My name is Kathy Kane. I'm the Associate Executive Director of Abbey Center for Mental Health, and I oversee our outpatient therapy and prescriber services.
Kathy, can you also just briefly talk about your role with the COVID-19 response and the mental health team?
Yes, I've been part of the LAP-AID team since 2008, which is the Area Partners in Disaster, and we're also working with the Unified Command with public health and with the mental health response, and taking a look at how we can get messages out to the community regarding mental health issues.
Okay, thank you. And Maggie, can you introduce yourself, please?
Yeah, I'm Maggie Hartzler. I'm with Tanager Place. I'm a clinical supervisor in our school-based program.
Thank you, Maggie. And thank you all of our speakers for joining us today. I just want to briefly outline what the format will look like for today's virtual town hall. The speakers have the opportunity to answer questions that were submitted ahead of time first. I will say that we did not have any questions submitted ahead of time that were emailed to our Linn County Public Health meeting account. So our team and our Joint Information Center came up with some commonly asked questions that we know are floating out in the community that people would like answers to. We're going to go through some of those questions and then open it up to anyone on the line that has questions for our panelists. We're going to be receiving those questions via the GoToMeeting chat function, or you can also email them to lcph.meetings@linncounty.org, and we'll get to your question as soon as possible. Like I mentioned prior to starting the recording, this meeting is being recorded and will be posted publicly so others can have this information. If you have a question for the panelists, you can go ahead and email it or chat now. Some of the questions we're going to start with are up on the screen for those of you that are joining via web or through the app. The first question is, how do I help my child cope with the uncertainty of the future and the disruption of routines? Is there a panelist that would like to take this question first?
Yeah, I can go ahead and take it. So I think that one of the things right now for kids, a lot of uncertainty was around school, right? When are we going back to school? What's that going to look like? How long is it going to be? And with the governor's announcement today that schools will not go back for the remainder of this school year, that helps guide a little bit of the conversation, but it still leaves a lot of disruption in routines. So having conversations with your kids about what they're missing most about their routine, what they're missing most about school, and trying to find ways that you can implement some of those routines into their day. We can't make home look exactly like school and make our living room look exactly like a classroom, but we can do certain things that help kids have some routine and structure in their day.
Thank you, Maggie. Another related question that you have started to touch on is, how can I help my child get through this difficult time? We know that for children, this is a uncertain time when their normal routines are disrupted.
Yeah, I think it's a lot of having conversations, right, in age appropriate and developmentally appropriate ways. We actually can talk to kids about how they have a lot of power right now in helping keep people safe and helping keep people healthy. So talking with them about the things that they can do to protect themselves and protect the people they love and protect everybody in the community by staying home and by staying out of school is a really good idea. The other thing is modeling talking about how you feel about it too. So talking with your kid about, yeah, it is really sad that we don't get to see grandma and grandpa anymore. And I feel sad about that too. And so practicing some of those things and showing kids ways to cope with that by you yourself coping with some of those things.
Great. And for any of our panelists, what can parents do that are feeling overwhelmed? Christy, I know that you have some experience in family mental health. Would you like to answer this one?
Yeah, I think we've been spending a lot of time with parents just helping them even process the fact that kids haven't even gone back from spring break, right? And now school is out. As Maggie said a few minutes ago, the new announcement of now they are teachers from now until who knows when, and what is summer going to look like, and those overwhelming feelings of when are we going to get back to some type of normal routine and structure. So helping parents identify what is really going on, where is the overwhelming feeling coming from, where's the anxiety that they may be experiencing, and getting to the root of where their feelings are really coming from, because we're all dealing with 20 different things that are overwhelming, right? And our kids, it's not just our change of in our workspace or not being able to go to the grocery store like normal. It's many, many different things. So making sure parents are taking care of themselves through self-care. Of course, gyms are closed, but there's many apps out there that people can utilize. There's, people can still go for walks. Of course, there's snow on the ground today, but hopefully this weekend people can get out and go for walks and be active in that way, making sure that they're taking care of themselves so that they are the best version of themselves that they can be right now for their family and their coworkers or whoever else they're coming in contact with. Because we struggle and put ourselves last, but this is a time where parents really need to make sure they're putting themselves first.
I think another thing that parents can do is understand that what they're going through and feeling is pretty normal given all the circumstances, and that more than likely they're not the only one that's feeling this way, and maybe reaching out to other parents, individuals that are their support system to just kind of talk through how they're feeling and how they're getting through their days.
Another thing that Teenager's offering too, just along those lines, is we're providing a virtual support group for parents, and that's meeting Tuesdays at 2 o'clock via Zoom. And that's something that you can check our website or our social media for, because we know that not everybody has that built-in village. And so, to provide some support and resources that way to connect parents who are kind of struggling with this new sense of normal and this uncertainty and out of control. We do have that as an opportunity for parents.
Right. I think there's so many virtual things out there now that so many people are doing. And right, finding those things and encouraging parents to, figure out what works it for them in their schedule and putting those things into place. Good points.
I would encourage parents too that, if they're feeling overwhelmed or they aren't sure even what resources might be available to them in the community, to call the Foundation 2 Crisis Line. We're a free service. We're available 24/7, and we can kind of help parents that are feeling overwhelmed identify different resources that are available currently in the community and how to access those and get them linked up if people are feeling overwhelmed or don't know where to start.
Those are all wonderful responses and suggestions for resources. I'm going to move to the questions that are on the next slide. We do have a couple of questions that are coming in through the chat function, so I will get to those as soon as possible. One of the questions that just came in through our chat is, what resources would you recommend for seniors and individuals with disabilities for mental health? For example, if they're working from home, clients that have services on hold, and they're taking a lot of mental health calls. Is Foundation Crisis Hotline a good fit for that?
Yeah, the Foundation 2 Crisis Line is a good fit for anybody that needs some additional support or needs somebody to talk to. We really see ourselves as a no wrong door access point to the mental health system. And so we can also get those individuals linked up with supports that are maybe more specific to their needs.
I think the other thing is the warm line is available from 2 to 10 every day. And that's a place where people can call in and just talk with someone as well. And as has been mentioned, that most of the agencies are all providing services in the Linn County area for mental health, whether it be, by phone or by telehealth. And so any of our agencies can help get people hooked up with where they need to go.
Very good. One of the questions that we identified ahead of time was to explain why self-care is important at this time. Would one of our panelists like to touch on the importance of self-care? And then going into question number 5, what are some easy self-care tips for people that might be new to this concept?
Sure, I can talk a little bit about self-care. I think right now, something that has been sort of a theme during this pandemic is that everything sort of seems to be amplified, right? So if we were struggling with some mental health stuff prior to this, everything feels a little bit heavier during a pandemic. We're sort of isolated from our supports, we're isolated from our normal structure and our normal routine, and everything is different. So self-care just becomes much, much, much more important when things get harder. So making sure that you're doing things that allow you to keep that sense of stability and that sense of wellness in your day, even when you're not leaving the house or you are not seeing the supports in the family and the friends that you are used to seeing. So self-care just becomes so much more important. And so some easy things that people can do. One of the things that we're talking a lot about with our clients is journaling, because you are in the middle of something really historic, right? Something happening that hasn't happened for, 100 years. And so journaling allows you to sort of document that and document your responses to it. But what we know about journaling is that it's really, really good for the brain. It sort of connects the emotional part of our brain to words. And so we can kind of process through some of those feelings in a really healthy, adaptive way. So that's one of the easy things that we can encourage people to do. But also, I think somebody touched on this, there are so many good apps out there for self-care like Headspace and Calm. And you can find a lot of really good, easy things to do and put into your day and into your routine.
I think the other side of that was self-care. I was just on another call and they were talking about the quarantine 15, because we're all keep just kind of feeding our bodies with maybe the not so nutrient dense foods and the sugars and all that. But the self-care aspect of what we put in our body directly affects our mental health as well. So, the foods, the alcohol, all of that maybe people are consuming a little bit more, just taking a step back and realizing how that's affecting our overall mental health as well.
I think when we're talking about self-care too, it's also, those are all really great and wonderful suggestions. But also things like going to bed at the same time every night and getting up at the same time in the morning, making sure that you're getting enough sleep, possibly limiting how much media you're consuming. So maybe setting set times during the day to watch the news so that it's not kind of a constant cycle or things like that can be important for keeping people healthy as well.
Very good. Another question for our panelists. Maybe many of our lives have been disrupted greatly, and this includes the availability of mental health or physical health services. Can you explain how mental health services have changed during this pandemic?
So this is Kathy. I can speak for, I think, the majority of the community, and Abbey Center as well, we're all continuing to provide the services. They might look a little bit different than what they have prior to this. Most people are working from home, but offices are open and people can come in, and we are providing by phone services. We're doing telehealth services, both for therapy, medication management. I know it was mentioned earlier about Tanager. I believe other places are doing some groups by phone or telehealth as well. So some of the services are still being offered. Taking new people and new referrals.
I think for us in the hospital setting, like the mental health services have changed. Just having to be more creative with how we are reaching people and meeting them where they are in a different way, not necessarily in the office, but providing those virtual groups, providing an opportunity for them to be able to call like an emergency number if they need assistance when nobody's in the office. Just kind of being creative and creating new programs around this and figuring out where people are, because it feels like every week, even the mental health needs are changing based upon where we are. So the announcement today of kids not going back to school this year, that may change what we need to do, or as numbers increase, that may change. So I feel like it's just kind of an ever-evolving, trying to figure out where we are and what people are needing at that time.
I also think there's been a lot more outreach going on, stepping up efforts to be connecting with people who have been in services, and just checking in with people to see how they're doing. I know another new service that Abbey Center is offering is free coaching sessions. So if someone wants to call in and just kind of talk through some things and kind of talk about what's going on for them, there's a free initial coaching session that is being offered, and I think other places in the community are, developing new things as well.
Yeah, I would echo all of that. Tanager Place has really worked on moving all of our services to a virtual platform so that we can continue to provide all of the services that we were providing before, just via platforms like this. But I think too, the other thing, outreach, like somebody said, has really ramped up. But I think too, there's an understanding in the community right now that there is a really great need for mental health services, because this is really, really hard to be managing and coping with. So I think that just the conversation in the community around mental health services has really increased, and I'm grateful for that.
Yeah, I would agree with it, because I think it helps to normalize it a little bit, and what everybody's going through different things and experiencing things differently. But it still comes down to, the feelings of isolation, feelings of anxiety, uncertainty, things feeling like they're out of people's control. And, many of us are feeling that on any given day. And so it's important to understand that people are not alone in what they're feeling and going through.
So to our panelists, this question came through from someone via the chat function. One of the panelists, and I'm sorry, I missed which one it was, mentioned another resource for parents on Wednesdays at 2 p.m. Can you repeat that information?
Maggie, it's the Tanager.
Sorry, I'm muted. Yeah, it was the Tanager, the parent support group. So I believe it's actually Tuesdays at 2 p.m. You can find all of that information on our Facebook page, on our website, and that's just a virtual, it's a Zoom meeting support group for parents.
And we also had one of our participants share that Catholic Charities is also providing telehealth counseling services for new and current clients. So it's an additional resource for mental health services. I'm going to move to question number 7 that we have prepared for our panelists. And this question is regarding, do you have recommendations for how healthcare workers, emergency medical services workers, and other frontline responders can cope with stress, grief, or other related experiences?
So that's one of the things that our mental health group is working on. with the incident command is that we're taking a look at kind of putting together a one-page, kind of tip sheet, I guess, for lack of a better word, for the faith community, health frontline workers, business community, how, with some consistent messages that really kind of talks about the daily stress, that we're all experiencing has a big impact on all of us, and that we're really experiencing normal reactions, abnormal type of situation that we're finding ourselves in with the pandemic. And so how important it is to take care of our mental health and stay connected with one another. So we're kind of putting together messaging that it's okay to not be okay, and to have people take a look at what they might look out for themselves, with one another. And we're kind of putting together one for the business community on how they can help employees. We're putting together for frontline workers around what they can do and the resources available. And we're also taking a look at some for the faith community and for parents, children, and teachers. So that's some of what we're working on, and we'll be getting it out to the Gazette and to many businesses and places in the community.
And this is Christy. The one thing we do know about healthcare workers, EMS, frontline responders is that they're not always the best at taking care of themselves and admitting they need the assistance, because they're helpers and their job is to care for everybody else and not necessarily take the best care of, put themselves at the front of that. So one thing that we've really been encouraging people to do is to talk to people. They have a difficult time because they experience trauma a lot, and they'll go from one traumatic experience to the next and not really process the one incident before they move on to the next thing. They just have to keep going and going. So making sure that they're talking and processing through the trauma that they're experiencing now with COVID-19, whether it's COVID-19 patients in the hospital, whether there's deaths in the hospital, family members, stress, whatever they're dealing with, we're really just encouraging them to process through a lot of that stuff. They also aren't good about taking care of themselves physically, as far as getting out. A lot of them, some of them are great at it, but putting themselves as first, as far as saying no to a different commitment and setting boundaries in different ways. They feel like they have to be there and always be the yes person. And so helping them realize the importance of setting healthy boundaries to ultimately prevent compassion fatigue in the long run. So kind of just helping them realize where they are and what they maybe haven't been doing all these years, and putting some better self-care practices into place now.
I think it's also important to remember that a lot of times with healthcare workers or frontline workers, they do deal with traumatic experiences on a daily basis. And so sometimes the stress or the grief doesn't hit right away, and it might not hit for a few days or a few weeks or even a few months after they have those experiences. And so making sure that people are aware that that's normal too, that you can feel fine while you're kind of going through this peak, if you will, but that there may be ramifications that come from this weeks or months down the road as well.
Yeah, and I would just add one more thing. Tanager Place is also looking at starting a similar support group to the parent support group that would be focused on those frontline workers who are really exposed right now to what truly is trauma. And so you can watch for maybe some announcements on our Facebook page about when that might be starting. But I think the biggest thing is, I think all of the providers and the agencies in the community are recognizing that we need to sort of expand our net to catch people that we normally have not targeted, but that there's such a need. And so I think we are all trying to rise up to that occasion and rise up and support people in increasing their resilience during this time.
Well, and I do know that the two hospitals, Mercy and St. Luke's, both have programs in place for their well, for various walk-in sessions or debriefings, virtual sessions. And so those are also being offered to community members on the front line and different organizations. So another resource that if you know somebody that's in one of those positions, you know, one of the hospitals or in one of the frontline positions, you know, make sure that you recommend that they check out their local employer too, to see what's available there.
Any responses? I just want to remind our people on the phone that are listening in that if you are joining via GoToMeeting, you could submit your question through, or you can email your question to lcph.meetings@linncounty.org. We do have one question that came in that I think is related to health as it applies to financial worry. I'll repeat the question and then our panelists can provide any responses that they have. So the question is regarding the school closure announcement today. So Governor Reynolds announced today that schools will be closed for the remainder of the year. It is possible that she may reopen non-essential businesses as early as May 1st. For parents with young children who will have to return to work, is there any funding or programs that will be in place to offset that expense, especially given that there are still many people that haven't received unemployment or a stimulus check? That expense alone could bankrupt many families. I think that's a very good point, and it brings up, well, I don't know the answer to that question in particular. I do think it brings up a good point about mental health related to financial stress or burdens. Do any of our panelists have a response for this? Got a little bit of echo on the line there. Was my question heard by our panelists?
Yes, I heard it. I don't know that I really have much feedback to that yet. I haven't really heard many people, you know, some people that I've met with have been very concerned about the future, but I don't know that it's, as far as the financial piece goes, some have been declined their unemployment and don't really know what that looks like moving forward for them. I guess the people I've worked with, maybe they haven't, the actual reality hasn't hit as to what it will look like for them. So I don't know that I have much feedback on that as well.
I can't speak directly to the question about, you know, a plan in place for childcare or those type of financial burdens that families are facing, but I can talk a little bit that financial troubles can be a risk factor for people that are struggling with their mental health for increasing thoughts of suicide. And that is something that kind of goes hand in hand and that we do kind of monitor and worry about, is that when people are under significant financial stress, people are more likely to think about suicide or possibly more likely to attempt suicide. And so I just would encourage anybody that's maybe having those thoughts or feelings or feeling overwhelmed by financial stresses to make sure that they're reaching out for help. There is support available. Like I said, Foundation 2's crisis line is available 24/7, 365, and is a free service. They can also link you up with our mobile crisis counselors who can do more in-depth suicide risk assessments, work on safety plans, and also recommend if people need to go to the hospital or anything like that. To make sure that people are staying safe.
Yeah, I also don't have a lot to add, but I would say that one of the programs at Tanager Place that does just an amazing job of connecting families to resources in the community is our Pediatric Integrated Health Program. And so if that is something that, you know, families are struggling with their finances and they need to know what supports and services might I qualify for in the community, our pediatric integrated health workers do a great job of connecting families with resources.
Good. The last question that we had prepared in advance for our panelists was, what should I do if I need help with managing substance use or addiction? What resources are out there for individuals right now?
I know St. Luke's has a chemical dependency department, and they outreach, and they are still holding groups. They're still doing assessments. They're still helping people virtually. So if you or someone you know is struggling with that, their St. Luke's chemical dependency is there and still helping people.
I've been on some phone calls with other providers in the community, so I know ASAC is open as well. Abbey Center has some, we do provide outpatient substance use services as well, and are doing some support groups. So I think there's providers that are in the community that are still offering their services, as Christy mentioned, for, you know, initial assessments, ongoing services.
Very good. I'm looking through our questions and our chat log that we've had available, and I'm not seeing any new questions at this time. So I'm going to just remind people one more time that if you have questions for our panelists, you can send it through the GoToMeeting chat, or you can email it to lcph.meetings@linncounty.org. Oh, here's a question that just came in. Are there any online screening tools that your organizations provide that people could access to help them identify what their feelings are in terms of like anxiety or depression?
I'm not sure if we have anything out there right now that is like easily accessible to the public, but I think that there are lots of resources right now online to sort of assess some of mental health and your indicators of need, and using some of those tools that you might find, and then connecting with some of these services to talk through some of the findings of what you're assessing yourself for would probably be a good place to start.
Well, and I know St. Luke's has, for our team members, we have something called Silver Cloud. I don't know how you can get access to that outside of, but it's out there. It has modules that you can utilize and go through different questions and assessments about anxiety, depression. It gives you tools to use. It's a really great tool. I'm not really sure outside of Unity Point Health who can get on that, but it is called Silver Cloud if somebody wants to do research on that.
Okay, thank you, panelists. It does look like we've answered all of the questions that have come through. I do want to take a moment just to share some of the resources that we know of. This is by far not a list of all of them, but just the kind of some common mental health resources in our community. We have, you know, callers, representatives on the phone from Foundation 2 and Tanager Place and Abbey and Unity Point Health. So we have our resources in the community related to mental health services that those organizations provide. Also, Mercy Medical Center has some resources related to family counseling, outpatient psychiatry, and then inpatient crisis stabilization, assessment, and related services. And then there are some community resources. So for example, the Gazette has a coronavirus resident resources page. Your Life Iowa is another statewide resource that is available for talk or text functionality. I believe you can also chat through their web platform at Your Life Iowa. Make It Okay in Iowa is also a resource available. And the Iowa Healthiest State Initiative has started Mental Health Mondays through their Facebook page, where they are featuring a speaker every Monday related to mental health topics. So I'm going to give one more minute for questions here, and then we can wrap up with our panelists. I do want to have our panelists let them have the opportunity to share any information that we haven't discussed through our questions. If you have any key messages that you want our community to know, go ahead and share that now.
I think just the biggest thing is, oh, sorry. I just think the biggest thing is there are lots of people out there who are wanting to help and support kids and families and community members right now. So I think the biggest message is that we are still here and we are still offering the same services, and we've really, most places have expanded. And so help is out there.
Just to expand on that, I just want people to know that you don't have to go through it alone. If you're feeling overwhelmed, if you're feeling stressed, if you don't know where to turn to, reach out to, you know, the different resources that have been offered today. You don't have to do it by yourself. There are people here that want to help.
I would agree, and I think that if somebody doesn't know where to call, if they just pick up the phone, call any of these numbers that have been listed, they will get directed to the right place.
Just going to say, I'm going to keep telling people it's physical distancing, not social distancing. So make sure you're socializing with people, even though we can't be physically close to people.
You're good. Thank you to our panelists for today for discussing this very important topic. The topic that we have planned for next Friday, April 24th, is information for businesses during the COVID-19 pandemic. We have been holding the town halls Friday at noon, but due to the availability of speakers, this may change, but we will post this publicly early next week. Once again, I just wanted to say thank you to our speakers, and we have a couple of thank yous coming in through our chat as well. So I hope everyone stays safe and healthy, and have a good weekend. Thank you all.